the percentage of heart disease, diabetes, obesity in our country is percentage-wise also it's higher than many developed countries.
We have sort of become so focused on one artery, which is the heart artery known as coronary artery, which produces angina or heart attack. But in that sense, we have forgotten that the diseases or the risk factors for which are there for causing heart attacks are practically the same which are there for the entire circulation or vasculature.
The coronary artery disease is very common in the younger population as well because of the metabolic syndrome and early onset of the ischemic heart disease.
These problems like hypertension, high blood pressure is present in more than 1/3 of the patients. 35 to 40% of our adult population is high blood pressure. 10 to 11% of our population is diabetes.
Increasing physical activity is recommended, that every person should at least walk 30 minutes every day or do some physical activity 30 minutes every day, 5 days a week. Or if he is not able to do it, then he should do 45 minutes of strenuous activity 3 days in a week.
We are seeing in the non-communicable diseases, it poses a high burden on the system also. If you look at the challenges which we are having, primary care we have invested a lot. We had 3 national policies which focused entirely on the primary health care. Now you have to think that how we balance between the primary care and the secondary care and the tertiary care. That's the kind of policy shift we are having.
So I'm a big believer that I think AI is really going to help augment the quality of care, the accuracy of care, and help doctors make better decisions going forward. I think it's important for all of us to learn, adapt to the technology so we can offer that technology to our patients because they deserve the best.
Regarding technologies, of course, Narayana hospitals are at the forefront of adopting every technology. We are quite comfortable with adopting new technology. We are a very flexible group. Minimally invasive procedures essentially have two impact. One is the post-operative recovery is smoother, post-operative complications are lesser, and therefore shorter stays. Patients के लिए it works out to be more economical.
One common myth about vascular disease you would like to burst?
That it is uncommon in India. It is one of the most common disease in India and across the world. India has the largest amount of vascular disease.
Because sugar does not kill. Because of the sugar, heart attack happens, that kills. So that is why controlling blood pressure and controlling sugar is important, because they are linked to heart problem. And if somebody is detected to have a heart problem, he should continue taking the medicines for almost the entire life.
Are we able to provide something for them, or are we able to do something, some policies which can impact large number of people like that?
I think I would improve the screening protocols that we have in the country. I would try to make screening more ubiquitous, more available, more accessible to everybody, because India is the heart disease capital of the world.
A healthy heart is a heart which can take up a load which is expected from you at your age and your body weight.
There is no shortcut to good health. You have to eat healthy, you have to live healthy, and only then will you be healthy.
Hi everyone, and welcome to this special episode of Big Idea. Today we will talk about how heart diseases continues to be one of the leading causes of deaths in India, and with lifestyle shifts and urban stress, the conversation around prevention and awareness has never been more urgent. Joining us today is one of the India's leading cardiologists, Dr. Professor Hemant Madan, Senior Director and Program Head, Cardiology at Narayana Hospital, Gurugram. Welcome, sir.
Thank you.
With decades of experience in interventional cardiology, Dr. Madan has been at the forefront of transforming patient care through innovation, clinical excellence, and education. Sir, so I'll start with my first question. Events like Beat 2025, National Cardiovascular Summit, and awards are encouraging collaboration between doctors, policymakers, and leaders. From your perspective, what policy initiatives are crucial to improve cardiac care in India?
See, I think events like this have a very important role. Doctors can only do research and they can only produce content. The penetration of this content into general public, penetration of this content into the local population needs a very serious collaboration. It can be at any level. It can be between medical and say school teachers. It can be between medical and newspapers. It can be between medical and media. And of course, events like yours, they actually bring the seriousness of the whole thing together. The question that you asked is, what are the policy decisions that need to come through? Policy decisions need to come through at several levels. We must make, as you said, heart disease is a serious problem in India. We must make awareness about heart disease in particular and about disease in general a part of our national movement. Much like cleanliness is now becoming a part of our national movement. So we need to tell people that the ownership is not with doctors. I often give this example that if you take your car to a mechanic, he can repair your car. I'm like the mechanic of your body. I can repair your body. But eventually it will depend on how you drive the car. अगर आप गाड़ी अच्छे से चलाओगे, गाड़ी अच्छी चलेगी. अगर आप अच्छे से नहीं चलाओगे, नहीं चलेगी. I can only repair it time to time. But looking after it is your responsibility. Similarly, looking after health has to be every individual's responsibility. Till we drive home this point fair and square, we will never succeed in the mission to health.
Okay. So, how would you describe the current state of cardiovascular health in India and what challenges are unique to our population?
Oh, it's a huge challenge. It's a huge, huge challenge. You need to understand that first, we are a very large country. We are a country of nearly 150 crore people, which is a huge population. Not only that, the percentage of disease, of heart disease, diabetes, obesity in our country is percentage wise also it's higher than many developed countries. So both the denominator is high, the numerator is also high. So therefore the effective number of people is going to be very high. 5% of 50 lakhs versus 25% of 150 crores. It's entirely different, right? So that, and add to that the fact that we used to think that we are a undernourished country. हमारा खाने पीने की कमी थी. Now food scarcity is not a problem at all. In fact, it's quite the other way around. We are now food abundant.
Yes.
So if you're food abundant, which is a good thing, but then you need to move on to the next level of eating right and exercising right. So it's a huge challenge. I think it will, in my conservative estimate, it will take us at least 20 years of active interventions at all levels to sort this out.
Okay, sir. So, sir, Narayana Hospital is known for advanced cardiac care. How are the technologies like AI, remote monitoring, and minimally invasive procedures changing the treatment outcomes?
Oh, it's having a huge effect. If I was to use one phrase for the role of artificial intelligence in current medical practice, I would use the phrase force multiplier. A job which would need, say, 10 doctors to do can now be done by a single doctor. To give you an example, one of our largest centers employs only one diabetes specialist, and he can look after all the diabetes patients with the help of AI, because AI analyzes their blood sugar reports, it sees their kidney reports, it analyzes their body mass index, and the whole treatment can be charted out based on an AI, and the doctor just needs to authenticate it. Similarly, if you have to analyze, say, 100 ECGs or 100 echocardiography reports, so as of now, AI is having a huge impact in terms of a force multiplier. Whether it will take over the role of a professional, I think we are still far away from it. It is not yet there, but who knows what the future is. Regarding technologies, of course, Narayana hospitals are at the forefront of adopting every technology. We are quite comfortable with adopting new technology. We are a very flexible group. So adoption of technology is very, very kind of, at the forefront of our thoughts. Finally, coming to minimally invasive procedures. Minimally invasive procedures essentially have two impacts. One is the post-operative recovery is smoother, post-operative complications are lesser, and therefore shorter stays. Patients के लिए it works out to be more economical.
Okay, sir. So I have a follow-up question with this. You've mentioned that AI से एक doctor 100 patients को देख सकता है. So I want to know how accurate is those reports generated by AI?
See, if you have to, by and large, they are accurate. no technology as of now is 100% accurate, because there are medicine mein there are a lot of hidden facts, there are a lot of, because it's a human body, and as of now I don't think we have the technology to say that this is 100% foolproof. But if your job, instead of seeing say 100 ECGs in 1 hour, if your job is to supervise a machine which is seeing 100 ECGs, it's much simpler. So that's what I said. The phrase to be used is force multiplier. As of now, it's a force multiplier.
Okay. So, sir, in your experience, how has the patient awareness and responsiveness into cardiovascular health have changed over the last decade?
The awareness has changed immensely. It has made practice, there are both good and bad in this. It has made practice easier if the patient uses his information properly. See, there is a difference between information, knowledge, and wisdom. These are three different things. What many patients today have is information. Patients come to us with information. They don't have knowledge, because naturally they are not doctors. I do not expect them to have knowledge. And they certainly don't have wisdom, because wisdom comes when you've seen this over the last 20 years, 25 years, then you become wise. So, through your medium, I would say that you must use your knowledge, you must use your information constructively. You must use it to test what a doctor tells you, whether it's right or not. But it should not become an argument. So information awareness has created a lot of positives, but it has also come at a price, that because of, as a subgroup of people, we are not very comfortable with discussion, with a diplomatic discussion. Indian, both doctors and patients tend to become a little aggressive about when they are questioned. If you question me, I get aggressive. If I tell you to do this, you get defensive. So that is where the problem is. Use your information to the best of your health decisions, but always remember that a person who's been in this job for 30 years, he's 2 levels higher. It's not only he has information which has translated into knowledge and which has translated into wisdom. So he's 2 levels higher. So if he's telling you something, Google or any other data analysis may not tell you. So that's the message that I want to carry, that it has several advantages, but then there are few limitations.
That's the difference between AI. The practical knowledge
Yes.
doctor has.
Yes.
AI can never be
Yes.
at that level. So, sir, I'll move on to our next segment, which is the rapid fire round. I'll ask few short questions and I would request you to give short and lively answers.
Yeah.
So, sir, one heart health myth that you would people to stop believing.
There are lots of them. I think the broad message is believe in science. But if there is one specific information, that is, there is a lot of WhatsApp knowledge on cholesterol and the role of statins. As I said, believe in science. Cholesterol is definitely harmful and statins are definitely useful. So please stop believing all WhatsApp messages which say that cholesterol has no relation with heart disease.
Okay. So, sir, a daily habit you personally follow for heart wellness.
Exercise. I do a fair bit of exercise. If you see my watch, on an average, it will be 12 to 14,000 steps in a day.
That's right. So, one emerging technology in cardiology that excites.
There are lots of technologies, but generally they are all matching up. See, cardiology is a vast disease. It's a vast specialty. So each year there are new technologies, but generally technologies are making hospital stays shorter, making patients recovery faster, and making surgical incisions smaller. So it's essentially a mixture of robotics with AI, with minimally invasive surgeries. That's the direction where we are headed.
Okay, sir. So, sir, in one word, what does a healthy heart mean to you?
A healthy heart is a heart which can take up a load which is expected from you at your age and your body weight. So if as a 30-year-old I expect you to run say 5 kilometers, your heart should be able to take it.
So, sir, finally, with my last question, what is the single most advice you would like to give to the public about protecting their heart health and leading a long and a healthy life?
I would give two advices. One is exercise, and second is get checkups done. Never be ignorant about your status.
Okay, sir. So, thank you so much for your time and sharing your
Thank you.
valuable insights. It's been a truly enlightening to understand the change in dynamics of cardiovascular health, from prevention and early screening to the power of technology in saving lives. Thank you for tuning.
Thank
You
you.
everyone.
Thank you.